Hello, everyone, and welcome back to FYI for Your Innovation, a series on healthcare innovation that we started a few months back. In the last few episodes, we spoke about the why and the what. Today, we're going to focus on the how. And one of the critical elements of how is technology. Emerging technology and how AI and other technologies are really transforming the way we look at innovation in healthcare and making sure that healthcare is changing, innovating on a daily basis. Today, for this conversation, I have with me Harish Gudi, CIO of Optum India. Harish, welcome to FII.
Rohit, thank you very much. What a pleasure it is to be here today. I really love the play with words, FYI, for your innovation.
Thank you. Thank you. Now, excited to have you here, excited to kind of get your take on technology and the role of technology in healthcare innovation. And maybe we start with that. Maybe we start with the larger picture.
Sure.
There's a tremendous amount of change that's happening in healthcare, as you know, over the last few years. Technology is a key role, plays a key role in that. If you think about technology like AI, like cloud, they're not just buzzwords anymore. They're making fundamental changes to the way healthcare is delivered on a day-on-day basis. Just the pace of these technologies making change in healthcare is immense, right? So I wanted to get your thoughts on how technologies like AI, cloud are really, really changing healthcare over the next few years.
Yeah, Rohit, great question. And you're absolutely right. A lot is happening in this space. And this whole combination of AI, all the new techniques we have with data, and cloud all coming together is starting to change the landscape on AI totally, right? But we should remember that with the use of more technology comes a lot of responsibility because we're in the space of healthcare. So I want to start by saying that the first things that technologists have to be on top of in their game, they need to make sure, responsible use of AI, right? What is data used for, making sure there is ethics is right, making sure the biases are not there. I think that's sacrosanct because all of us, first of all, carry a huge responsibility on our shoulders of getting it right the first time. See, because after all, we're dealing with human lives here, right? Now, with that said, with that being the overarching thing that we have to be careful about, huge amount of things happening, whether it is on the payer side, provider side, consumer side. Let me start with consumer first, right? More and more consumers are wanting the kind of experiences they have in retail and in banking and other industries, in healthcare too. So consumer-centric healthcare is becoming sacrosanct. It's becoming the most important. Some of the things that are going on, and we've done that inside our organization too, is looking at consumer-facing applications. We kind of now have the number one app out there in healthcare, which is able to help consumers with seamless access to care, appointments, scheduling, understanding status of their services and status of their claims, and being able to, price and find care. I think these are all the things that are happening from a consumer-centric point. Now, it feels like, hey, this is one good design, front-end UI app, but behind the scenes, there's a lot of interplay of data, AI, and analytics that has to come together to give consumers this experience.
Yep.
Let's look at what are the standard. Let's pick one challenge, right? The consumer has a question, has a query. They've probably interacted a couple of times and are looking for a good, quick and good solution. Today, what AI is able to do is identify which consumers need help, integrate data across systems, across departments based on usage that is allowed, and put together like a view for our advocate to tell them what this consumer is looking for and how can you help them. What this does, it reduces a lot of friction, abrasion, because in one call, now I'm able to address what the consumer is looking for. AI is taking it even a step further. We are able to identify reasons why the consumer might call tomorrow or in the future. And AI is able to extrapolate all that information and let us know that, hey, this consumer might have a need. You may want to proactively address that. Now, that can be done either through the app or through digital media. What this does is satisfies the need of the consumer, and they feel like hey, look, I'm proactively being given the information that I wanted anyway. And I think that's the magic that AI is able to create today on the consumer space. Let's look at payer, practitioner, care provider space. What is their biggest challenge today? Huge amount of procedures in terms of documentation and things to be done and followed. And hence, physician fatigue, less time to actually do what is more important, which is empathize and spend time with the patient. Today, we have technologies that are able to help note taking, to take away the administrative roles of the care providers so that they can focus on what is most important for them, which is taking care of the patient and taking the right decisions for them. Last but not the least, a lot of effort being made to make the healthcare system work better for everyone by making provider payer transactions seamless. Like we now have products out there that we use internally and in the market as well, to seamlessly be able to, work with claims across payers and providers so that it's easy and it happens in first pass and there's not multiple rounds. In this entire ecosystem, everybody is benefiting because the member gets what they want faster, sooner. The providers get what they want faster, sooner. And the overheads of rework and, going through back and forth multiple times on data to get the decisions is also simplified. So these are the kind of interventions that are happening in the ecosystem today.
No, thanks a lot, Harish. I love the point around consumerism, right? Because at the end of the day, healthcare, I think, is perhaps the place where, this entire industry needs to be extremely, extremely about the consumer. Because it's very personal, right? It impacts lives, right? And that is why the more we're able to focus on the consumer, keep the consumer at the center, I think the better our focus on providing the right solutions and making sure that we're innovating, keeping the consumer at the center.
Absolutely.
I also love the fact of what you mentioned around being a little bit more proactive, right? Rather than being very reactive in the way we think about solutions, think about healthcare. Being a little bit more predictive, being a bit more precise, being very personal. I think that's the only way we can really drive healthcare innovation and do it at a way that it can be scalable across the entire value chain.
So you talked about being more predictive and being able to understand outcomes and get better outcomes. VBC, right? Value-based care, where we are trying to build affordability engines to look at how can we standardize care, how can we reduce errors, so that care protocols are standardized and delivered without much error. So value-based care is a big part of what you just said as well.
No, absolutely. And, I think all of these solutions put together will just help make sure that, we're becoming, like you mentioned in the beginning, consumer focused. But, as a company, right, we're known as, the innovators around healthcare. So great thoughts, right? I think also if you really think about all of this innovation cannot happen in silos, right? It needs to be done in a way that you're bringing multiple elements, multiple people, multiple voices together, right? Collaboration becomes so critical, right? Gone are the days when you can think about, small elements of the problems that you solve. A lot of the low-hanging fruits are already taken away.
Right.
And the only way that you can solve large, big problems is by, I think you mentioned it, data, process, technology, all coming together. I know we do this really well in Optum. So what are your thoughts and some of the ways in which Optum technology and Optum operations coming together to really drive innovation?
Beautiful question. Innovation happens at the seams. Cutting edge innovation happens at the edges, right? Which means it happens at the edges where ops meet tech. It happens at the edges where engineering meets ops. It happens at the edges where product meets tech and ops. And of course, all the practitioners out there who are the caregivers, nurses, practitioners. Obviously, you're aware of the program that we are running currently, which is called #SitWithOps. This is about not sitting in your cube or corner office and imagining what somebody might want versus going zero distance and sitting down with them on a daily basis to see what they go through as an advocate, to see what members go through from a experience perspective, to see what nurse practitioners and providers go through on a daily basis. When you zero in and go deep, you're able to do real solutions. And you're able to do solutions that are at the intersection of all these, people who are using your solutions, and also at the intersection of data in the cloud and etc. I think that's a big thing that's really, really worked for us. If you look at advocates out there, they're trying to do good work, but overburdened again by administrative tasks that they sometimes have to do. There is toggle tasks, toggle tax. There is multiple applications they have to go to look up information. A lot of the quick AI is also able to help get all these interfaces and seamlessly together to be able to help the advocate spend time on what it matters and not on this administrative lookup. Remember, it also reduces a lot of friction and frustration in the minds of these people who are working. For them, the most important thing to be successful is not the tech and not just the job of getting these tasks done, but to be able to empathize with the end user member on the other side.
Yeah.
And if that's the focus, you can't be frustrated yourself.
Correct.
And these are things that we're trying to do in the system to enable that. Then, of course, right behind you, innovate. Right? So all bottom-up ideas, bright ideas, tech tank, that all roll up into ground-up ideas, because sometimes you don't see the ground-level challenges when you come up with top-down approaches. So it's very important to take bottom and top-down approaches and make the ends meet to give the real innovation to people who matter.
Great examples. Sit with ops. I've seen this in action over the last 2 years, or maybe a little bit more than that, right? And whenever you do this yourself, as well as whenever you see people doing it, you can literally see those light bulbs, flashing, right? And it's just an amazing way of getting the right people together and helping people really empathize on the problems that everyone else is facing, right? Tech understanding the ops problems, ops understanding roadmaps, ops understanding what are the new changes that are coming. And that, I think, intersection is so important to drive innovation.
And technology is helping even in these interventions today, right? If you look at task mining or process mining, even that is now getting so highly powered by AI.
True.
That we're able to take 10,000 advocates who are doing particular process. Obviously there's multiple streams and complications there. But if I put a process and task mining, AI-led, on top of all of that, we're able to garner these insights and say, here are the top 8 things if I solve, I can reduce the average handling time, I can increase my advocate NPS, and be able to reduce frustration.
Correct.
A lot of technology is enabling even these discovery exercises today.
Absolutely.
So, yeah.
And you spoke about Innovate, right? Innovate, which is our innovation platform, right? It's really helping us democratize innovation, right? It's helping us make sure that whether you are a frontline agent, the advocates that are handling calls, the claims associates, right? Or you are executives in the company, managers, leaders, right? It's creating a common language that everyone can use to talk about ideas and ways in which they can solve problems. Again, keeping the consumer at the center. It's bringing together, like I mentioned earlier, data, technology, process insights, deep insights that we get from task mining, all of them together to be able to create solutions that are focused on the right problems and are helping us deliver value and solutions at scale, right? And I think that is a very critical element of how we drive innovation. None of that, though, is possible without the people, right? And I think with the advancement of technology, I think it's very important for our talent to also make sure that they are future ready, right? And I think the tech talent, the way that they are making sure that they drive the innovation is going to be critical for the future. So, Harish, I wanted to get your thoughts on the role of technology talent in the future of innovation in healthcare.
That's a very interesting question, very obvious answer, but let me break this down a little bit, right? We're talking of technology here, but the talent is not just technology, right? Talent needs to have technology, needs to understand the business, domain and principles, and need to know how to articulate and tell a good story. Technology, we already talked about the fact that you really have to be good at AI. It's AI in everything. cloud is important, data and analytics is all important, and these have to all come together. From a tech talent perspective, we have a lot of investments in training that we are doing across the enterprise. For example, we've worked on an AI dojo certification, which is kind of becoming the leading AI certification in healthcare. They end with healthcare examples, healthcare use cases, and healthcare capstone. We run this with the Optum Tech University, and more than 60-70% of our staff now is actually AI dojo certified. Then, of course, we have cloud trainings on various cloud models because we are a multi-cloud environment, that we have certifications there in data and analytics. But look, more importantly, it's imperative that our people understand business domain well, right? You can train on AI, you can train on business separately, but the advantage that we have at Optum is we have people who've been in the organization for a long time now.
True.
And the journey of transforming the existing talent into AI first talent using, interventions like AI Dojo and, Copilot certification that we are doing makes a big difference. To add to that, we have a good number of ops
Correct.
training that is in progress. In fact, as part of some of the tech training, particularly on Copilot, where you can, play with technology, even though you may not be a real coder, more than 500, 600 people from ops have also participated in that and ideated as part of that. I think that ecosystem has really come out well. Obviously, from time to time, we instill fresh talent as well from the outside who are AI first talent. When these two powerhouses come together, ingrown AI talent, which is deep in domain and have transformed themselves, and AI talent that may not necessarily be healthcare but has come from the consumer industry, come from the retail industry, come from consulting industries, when you combine all of these and create solutions, magic happens, right? The reason I'm saying magic happens in this model is because people who work on these problems have to have a deep understanding of healthcare policies, healthcare technologies, healthcare compliance, right? And deep domain knowledge. Without that, this transformation does not happen. Last but not the least, you have a great idea, but you can't tell a good story. You can never convince anybody that it's a great idea, right? Yes, you might get lucky. You might have somebody who really, really listens well and sees that light bulb go off. But I think it is very important that all our talent know to innovate and to tell the story of what they're proposing, because that's when you can bring it to life. I think this is what makes talent well-rounded and not just some one technology tool that I can use and make a difference happen.
Well, that's so true, right? And I love your point on domain, because this is an industry, this is a place where without understanding the underlying factors, the process, the technology, your ability to make changes is not going to be easy, right? Like I said, gone are the days when, a simple fix could solve problems and bring a lot of value. Now we're solving really complex problems, and your understanding of your domain, combine that with technology and just the hunger to look at innovation is so critical. I love the way we're thinking about training on AI, which is very persona based, which is making sure that we're capturing and going out to various personas and people that are existing within the organization.
Right.
So it's not just technology, it's all of technology, all of operations, all of functional areas, and catering to different levels of the organization. Because at the end of the day, when you put technology and talent together, I think that's the only way we can drive innovation which is sustainable and can really scale across the organization. Harish, this was really wonderful. Thanks a lot for your thoughts. Thanks a lot for your insights. It's clear that innovation at Optum is obviously trying to make things better, is really rapidly making changes to the lives of the people that we serve. But it is also sustainable. It is also deeply, deeply human, which I think is something that we as a company strive for. It's there in our mission, it's there in our vision. So thanks a lot for your insights. If you think about, like you mentioned, AI, if you think about cloud, if you think about the focus on domain, the focus on talent, I think those elements coming together is making sure that we're really making changes that are not just, vision. It's making changes that are real and that are changing day on day lives of the people that we serve. So thanks a lot for your inputs.
Absolutely, Rohit. So let me just say this one more thing, right? Yes, we're making a big difference with technology in innovation in Optum and at UHG. But look, remember, what's our mission? Yeah, we are here to help people live healthier lives
Yep.
and to help make the health system work better for everyone. So, as technologists out there in the industry, we are also out there with solutions, products, and services that are available to the healthcare ecosystem with a simple and single motive of making it better for everybody out there and not just for ourselves. Rohit, thanks a lot. It was a pleasure talking to you, and I hope we can do this more often.
Likewise, Harish. Thanks a lot. And to the people that are tuning in, thanks a lot for watching. Thanks a lot for listening to the fourth edition of FYI. Hey, remember, innovation that is driven by empathy, powered by passion, and enabled by technology is the kind of innovation that will last. Is the kind of innovation that will stick and make sure that we're changing lives on a day-on-day basis. Thanks a lot for watching. Keep innovating on a daily basis. Thank you.